Welcome to another episode of Behind the Needle. Today I'm here with Adriana Medeiros
Yes.
from Lux Lab Aesthetics in Tucson. It's Oro Valley, Tucson right there, and I'm excited. You came all the way up here for this, and let's be honest, you came because there's a Gucci store up here, and I saw your story yesterday. You made it a trip.
Yes, I made it a trip. All
And
business.
yep, for the business. That's a write-off, right?
That's a write-off.
Tell Ryan, your husband, that's a write-off.
It's a write-off. He might not agree, but he doesn't have to.
It might not actually be a write-off.
Yeah.
But we'll pretend it is. We'll pretend it is.
We can
Did you
pretend.
say that he was going to let you go back there too? Is that?
I think we might take a trip back to Fashion Square after we're done here.
That's cool. It's a good place to go. I'm excited to have you on today. Before we started the rolling, we were talking about cadavers.
Yes.
And I'll give you a trigger warning. If you don't like talking about cadavers and dead stuff, you probably want to skip over just a little bit of this part or when we talk about it. But it was really interesting to me, and I liked that you've done that, because we also talked before we started rolling just about people can get treated by someone and they're not actually even licensed. And what spawned this conversation was we were discussing just something that I had seen on social media the other day about a guy who had given himself a chemical peel on his own, a legitimate medical grade TCA peel on his own.
High percentage at that, 30%.
Yeah, that's crazy.
Yeah.
It almost makes me wonder if it's real, because like, why would anyone actually ever even do that? But his skin changed immediately, and it was freaky. It was freaking me out. And we just talked about that. So we talked about some of your training and the different things that you have done. So we'll talk about that here as we're recording, of course. But let's talk about how you got into everything. You started off as a nurse. You graduated in 2014.
Yep, 2014.
And then got into and what kind of nursing was it?
I did a little bit of everything. I started off in med surge, did a little acute care, did some dialysis on the acute care side. Also took care of pediatric dialysis patients for a little bit.
That's a lot.
And then a couple years in, I was single, not married, no kids, and kind of bored. And so I started looking for something else to do. And I saw a med spa posting, and I said, that sounds fun.
Really?
And
did you know like what med spas did before you applied?
I mean, I had an idea.
I
knew what Botox was.
Had you ever gotten it before?
No, I had not. And
no lasers, not even a facial, not even a dermaplane.
I mean, facial, yes.
Okay.
Dermaplanes I've had, but nothing else at the time. I was fairly new, and it was not something that I was looking to do. So it kind of just fell in my lap. And so I applied, and I didn't get the job the first time, but I was their top 2 candidate, so they ended up calling me a couple months later, and then I took the job, and I started doing lasers, and then was introduced to injectables and things like that.
And why didn't you get the job?
Because it was like a process. It was like a whole process. They interviewed tons of people all at once, and then we were all taught, and then we did like a didactic type of thing. Wow. So they did call me, and they say, you were our top 2.
Did they say it was because of not actually having injected yet?
I don't know if that was, I honestly didn't ask, because it was something that I really was
like, okay,
well, let's
no
try that. I've got nothing else to do. I work 3 days a week, and I'm free a lot of times for a whole week. So I'm like,
what am I going to do with my time?
Mm-hmm.
Okay. So they called you back, and then were you like, sure.
Yeah, they called me a couple of months later. Actually, it wasn't very, very much longer. And I took the job. And of course, just like everybody else, I loved it. And here I am.
Yeah. So how long, and that was in 2018. And then when did you leave your other nursing gig to go full-time into aesthetics?
I wasn't full-time in aesthetics for the first couple of years. I was working in the hospital and doing that a couple of days a week.
So then COVID happened.
Yeah. And
you were still doing both.
No, I left to go back to school, and it was right before COVID that I finished NP school. So I was working part-time at the hospital, really like 1-2 days a month, to be honest.
Wow.
Just focusing on school and clinical. And then once I graduated, one of the doctors that I knew very well kind of pulled me to transplant. He's like, hey, you'd be great here. So that's how I ended up there. And that's where I started as an NP, got the medical background. And then I decided that it was time. And my husband played a big factor in go for it.
Yeah.
So
we love a supportive husband.
Yes.
We do.
I love a supportive husband.
We do.
Yes.
When you finished right before COVID started, everything changed. Were you still doing nursing in the hospital and acute care and all that? And then you were also still doing aesthetics again, or what happened?
I was actually just I actually was just doing school for a little bit.
Right. Because it was only school. And then once you graduated,
Once I graduated, I just went straight into transplant, and then COVID happened, and we were just doing telehealth for a good amount of time.
Okay. So
I was seeing patients at home.
Yeah. And were you like, I really hope that this ends because I want to go back into aesthetics and inject people again?
Yeah. I think that was always end game.
Yeah.
I knew I wanted to open a practice, I think, from the moment I started injecting.
You knew you wanted to open your own?
Yes. Mm-hmm. Yeah.
How did you know that you wanted to open your own as opposed to going and working for someone? Like, there's a lot of pros and cons with both, right?
Yeah. I think when you work for somebody, you're doing things under their terms, and you find some things that just don't align with your values and ethics, and then you're like, okay, I think I should open my own place under my terms, under my rules. I get to treat patients like I want to treat them, and not how somebody's telling me to treat them. Or some med spa places are just very salesy, and that's just what they push. And I'm all about patient care and patient experience, and that's kind of what I base my practice off of.
Yeah. Walk me through why you feel like you're different, or what you have created that feels different, like it feels like you, like compared to what else you've seen. You just referenced that it was different at the place you were at, which is fine. Mm-hmm. What did you do to make your Lux Lab stand out?
Yeah, I think what makes me different is the experience is big for me. And I read a book recently, and I'm like, yes, that's me.
Okay.
It's called Unreasonable Hospitality. Have you heard of it?
No, it sounds good. I'll definitely look at that one.
It's really good. It's Will Guidara wrote it, and he talks about the experience being just as important as the product or the service that you're offering.
Yeah.
And I'm like, yes, that is exactly what I base my practice off of, is just the whole experience, and just making the patient comfortable from the moment they walk into the door to the moment they walk out. That is literally what I obsess over, and that's what I teach my team. Yeah. And that's what I do.
And do you feel like before you read the book that was the ethos before, or did it change? Did the book change your mind and you kind of implemented things from that?
No, I think it just reinforced what I really wanted and what I was thinking when I opened. I'm like, yes, that's exactly what I want to do, is just unreasonable hospitality. That is exactly what I want to do. And I think my patients feel it and see it, and that's been a big part of my retention. Yeah. I know my patients and everything about them, from their face to the treatments they've had to their family life. And I just love building that connection and that rapport.
I'm going to ask you, I'll give you some time to think about it while I'm talking. Mm-hmm. I want you to, if you could, just tell me a couple of nuggets or things that are different about your process and how you help people feel taken care of compared to what you've seen others do. And I believe, what we do is we get new customers for med spas. Mm-hmm. We do this through paid ads, mostly through Meta. Mm-hmm. And the baton handoff to you is once they're booked. So we literally do everything before that. And then all the way to booking, we take care of it. So the med spa doesn't have to do anything. Then we say, here you go. Have your system that you run take off now, right? And I still talk to my clients. We track the revenue that comes in from the bookings that we get. And so I see average ticket. I see retention rate from the new bookings. I see membership sales. Like, I see all of it because we track it. And the conversations that I've had with the clients, I can tell from a month of working with people and a month of data if they have a great team or not. Mm-hmm. If they have a good system in place for, getting people to pre-book an appointment. Okay. And so one of the things that I say is transparently, the reason that ads work is not because of what we do. It is, right? It is. But the reason that they work over time is because of the team that you have. Correct. And because of your standard operating procedure of how you're taking care of the patient. So what are some things that you do? And this would be helpful for people who have not booked with you yet so that they can see why you're different. It will also be helpful for people who are with you to realize why they should never go anywhere else. and other people will also find benefit from it too. But what are some things that you do differently?
I think just the flow of the practice is important, and it helps in retention.
What do you mean the flow? Like talk to me about
when
that.
They walk in the door, I have Carmen, who is my patient care coordinator / front desk, who they've been communicating already from the beginning, right? They've booked their appointment. They've talked to Carmen over the phone a lot of the time. If not, she's texted them to remind them of their appointment to see, are you still coming?
Yeah.
Is there anything we can help you before your appointment? So they already know her before they walk in the door. They're like, oh, you're Carmen. I've been talking to you for the last couple days.
So there's rapport built before they even walk in.
Yep.
The stage is set. Okay.
The stage is set. Once they walk in, she says hi and welcomes them. And
Carmen knows exactly who they are.
Exactly who they are, because she's already also knows who they are, because she's been texting them as well, answering their questions and whatnot. So they walk in, she hands them a water, asks if they need anything. You use the restroom. Adriana will be right with you. And when I take them back, and just like you said, we run paid ads too. So my job is retention and having those patients trust me. So I think the trust factor is huge when it comes to what I do. And I've been an NP for a while. So I did this without even depending on a money coming in, right? Depending on, it was a paycheck that I was already getting. So it was money that was a whole different company, if that makes sense, right? It was the corporate's money. So I did it out of the goodness of my own heart, because I am a provider at heart. And that's what I do. I think aesthetics is medicine. So when somebody walks into that door, you're greeting them. And the first thing I do is, obviously, I ask them about themselves. I get a little medical history, medications they're taking, good faith exam, very important. And then talk about them. Like, why are you here? What brought you in? You're sitting in my chair. Obviously, you have some concern. So we start there. I do my consultation, and then we get into treatments. And I ask them if there's specific treatments that they're interested in, and we start there.
Like, have you seen me post about anything, or have you seen anyone talking about this online that you wanted to discuss? That's good.
Yeah, and I think that just breaks the ice for them, and then they just feel comfortable. And then I just educate, because sometimes people come in and they think that they need something, and our plan of care is just completely opposite of that.
Yeah.
But social media plays a big role. But my big thing is just educating patients, and I think that's where the retention comes in, and also just building rapport. Like, I ask my patients all the time, like, how's your daughter doing? How's your dogs? They come in and their daughter's about to get married, and then I don't see them again for 3 months. And then when they get back, it's like, how was the wedding? So that's the big thing, is just building rapport with my patients. Education is huge for me. So I love educating my patients on the what and the why and the how and all the things that they need to know. So
I feel like medicine is the key word that customers forget.
Yes.
This is aesthetic medicine. It is not anything less than real life medicine, right? There's science. And I love that aesthetics is not just because this is a vertical that is being built now. And I love that it's not just going off of the same way that it's been operated in other types of medicine. Meaning, I went to the just PCP, new one, like 2 or 3 months ago, because I had a cold sore and I needed some medication. Mm-hmm. And I was in and out in 15 minutes. And by the time I left, I had a script, but I also was now worried that I had hypertension. And I was already being talked to about some coronary tests and calcification of my arteries and potentially getting on blood pressure meds in 15 minutes.
Yeah.
Guy had never met me before, trying to hit a home run. And I'm like, bro, no, we don't do that. We take this slow. I actually ended up, I've talked about this on different episodes, but I actually ended up buying an at-home blood pressure cuff.
Good
and
job.
My blood pressure's normal.
Yeah.
I was nervous, I guess, white coat syndrome, whatever. But I think that that's the culture of medicine in general. And I love that aesthetics is going away from that.
Yeah.
It is very easy for you to say, I'm going to stack as many people as I can. I'm going to take 10 to 15 minutes with everyone, just like when I was doing acute care or transplant or anything. And what people are telling you to do, your bosses, the corporation, like, you've got a quota to fill. You have to hit this many patients in a day. Otherwise, we're going to lose money. Mm-hmm. I just love that you get to say, no, and you could still have 2 patients at a time.
Yeah.
Easily, where you have Carmen who's talking to one of them and getting them prepped, numbing them, whatever they're doing, and still take care of people. But that's why I love aesthetic medicine. Mm-hmm. It's just so much different. And truly, like, it's all elective. It has to be better. It has to be different. And I've never gotten injected with anything because I'm nervous.
Yeah.
And everyone is nervous to some degree, because if you've never done it before, you don't know what to expect.
Yeah.
So I really appreciate that you do that.
Yeah. And a lot of time it's just, like I said before, breaking the ice, but education is key. I see a lot of people that have never had, or patients that have never had anything done before. So they're nervous. And once they're educated on what these procedures actually are and what they do and what to expect, and
that it's not going to make them look fake.
And I mean, there are complications and there are things that happen because, again, these are medical procedures. So letting patients know that these things happen, but they're more rare. Yeah. If you're doing things in the hands of somebody that knows what they're doing. Yeah. So I guess the point I'm trying to make is education is key. Yeah. Once the patient has been educated, I feel like they feel relieved. Like, oh, okay. So that's what I love doing. I love educating. And like you said, I don't want to see a patient every 15 minutes. That's not my goal. I give every single patient, even my established patients that I have seen 5-10 times before, I've give them 30 minutes and I can do their Botox in, of course, 10-15 minutes. Yeah. But I like to sit and talk to them and how have they been and how's it going and how's life, right? I don't like to rush. Yeah. And my consultations are a full hour. I want to know everything you want me to know. Yeah. And my goal is not to be a giant practice. I want it to be small. I want my patients, a lot of people say that, like, I love that it's small in here. I've had a lot of people sit in my chair that have said they've been to other med spas and they just felt like cattle. It's like, okay, next person. And these are elective procedures. 1, 2, they're very expensive procedures. Oh, yeah. People are walking out sometimes spending thousands. And so you have to treat patients like you have to give them that experience, that VIP experience. Every person that sits in my chair is a VIP patient. Yeah. I don't care if you're just here for something as simple as a facial or you're getting a full face of filler or Sculptra. I think that every patient should be treated that way because it's elective and you're here for that experience. I think that's what people pay for. And I think that's a big reason that my retention is what it is and why we're growing. And
that's the key. If you want to retain your clients, you have to make them feel wanted, seen, heard, like you actually do care. If you don't actually care that they're there and you're just churning and burning as many as you can, they're going to go find someone else. That's the key. You get it.
I get it.
That's awesome.
I get it. I've been on the other side of things, and I also get being in a place where you feel uncomfortable when from the moment you walk in, you walk in, the front desk greets you and then doesn't say a word, and you're sitting there like, can't wait to get back to the
room.
room.
I'll check my phone again.
Yes. What do I do now? And so I don't want to give that. I want to give everyone a great experience. So
I love that. I thank you for operating that way.
Yeah.
I guess, is that okay to say thank you? I mean, it's just the right way to do it. I love it. So you've had a lot of training. You've done in-person training with some people that I know and are very, very good at what they do. And you've done your cadaver labs.
Yeah.
What do you feel like was the most interesting training that you've done so far? Was it the cadaver? Will you just say that it was? Because I want to ask you questions about
interesting, yes. Interesting, yes.
Okay.
And I love training with different people because you can pick their brain about what they're good at.
Is that a joke? Because that sounds like a cadaver joke.
We're about to talk about picking brains, yes.
Okay.
Not really the brain, but I mean, if you technically we're pulling the layers to get to the brain.
This is the trigger warning. This is your trigger warning. If you are squeamish about blood, guts, things like that, fast forward just a little bit. Yeah. But okay, so the cadaver lab. I was a little grossed out when you gave me the details before we started recording, because I know that a cadaver is a dead person. I understand. Yes. And then I said, how does it work? So would you please talk about your experience in the cadaver lab? But first, tell us why you did a cadaver lab. Like, why go see a dead person and learn about their face?
Anatomy. It's important in injecting and just in general in medicine, but as an injector, knowing the layers of the face is very important because
and layers of the face. Sorry.
No, you're good.
The layers of the face meaning the skin, the fat pads, where the muscle is, where the bone is, all of that. You've heard
this before. Yes.
Sort of, in ways, but not about this specifically. Mm-hmm. So when you're looking at the cadaver, you peeled the skin off?
Correct, yeah. So the cadaver is set up
like you cut the skin and you just go, hey, let's take a peek under the hood, and then you're like, boom, there it is.
Yes.
Okay, now go ahead, talk.
It's a cadaver head.
And it's just the head.
It's just the
head.
There's
no body.
No body.
Where are the bodies?
Don't ask me that question. Right. I have no idea.
They're in other cadaver labs.
Other cadaver labs, probably being used for science, because science is amazing and everybody has their own specialty. So they're learning about different things.
Yep.
And mine is just the face. So all I need is the head.
You just need the head. So you're looking at a head and you say, thank you, Jeffrey or Janet, for being here today and donating your body to science so I could learn.
Yeah.
Do you know their names?
No, you know their age.
That's good. I feel like it would be really weird if you knew their name.
Yeah.
Yeah. Here in front of you is Janet, 63 years. Okay, so you know their age. Mm-hmm. And they never come, I'm assuming, with like trauma. They're just like normal looking people.
For the most part. I mean, they don't want any trauma to the face, right?
Because then it looks irregular.
Yeah, or, it can compromise any tissues that we need to learn about. So,
yeah, okay.
But yes, they're set up in a way to where we can peel the layers and then look underneath that layer and see what's there. And so you peel the skin, then you make it to the superficial fats, then you're in the muscle, then you're in the deep fat, and then eventually, obviously, you get down to bone.
Yeah.
And it's important because different injectables are injected in different layers of the face, right? So some are better injected in the deep fat, some are better injected down to bone, some need to be right in the muscle, like Botox is it's a toxin.
Yep.
That's
so you have to know how far the needle needs to go in.
How deep? Yes.
So when you're injecting, do you see how far the needle is going in from the top level of the skin, like on a real person? And you're like, okay, I know that the needle needs to be halfway in for this Botox. Mm-hmm. It's there.
Yeah.
Boom. Like that's literally what you do every time.
Yes.
Wow.
And everybody's different, right? People's skin sometimes is thicker than others.
I was going to ask that too. How thick is the average person's all layers of skin? Is there a way that you can answer that?
I mean,
it's got to be a range, right?
But everyone is different too. And have they had treatments before? That makes a big difference. How old are they? So
age The older they are, the thinner their skin gets?
Correct.
A lot thinner.
You lose a lot of collagen and elastin as you age. So
if I'm on medical grade skincare, getting facials, getting lasers, is my skin thicker?
Probably stronger, yes.
Stronger and thicker? Maybe?
Could be if you're getting treatments, yeah.
How do you know how thick someone's skin is? I'm really interested in this if you can't tell.
You wouldn't unless you're a cadaver head, and you can sign up to be a donor if you'd like.
I am an organ donor. I am.
Good.
I hope that you never see me in your cadaver lab, though. Yes. You'll know my name. That will be weird, but I hope that you learn something from it. So really, ultrasound is a tool that you can use to see depth and things like that.
Yeah, ultrasound's really important. The cadaver is really cool to just get an idea, but different heads are different ages. So, which is really important too.
Because the fat pads will sag and go lower, and then you have jowling.
And it's really cool because you can have like your partner, your neighbor can have a 60-year-old, and then you can have an 80-year-old, and then as you're peeling back the layers, it's like, oh wow, look at that, how much their fat pads have shrunk, and they're 20 years apart, and you can actually see that as you're peeling back. So it's really cool for me.
I think this is amazing. Yeah. I love this. How many cadaver labs have you done?
I've just done one.
Okay.
Yeah.
How many heads did you see?
We saw a couple, but you're kind of like assigned to a head. Okay. But it's really cool in that one, you're peeling the layers of the skin and learning about each layer and also how they work. But the cadaver labs are really cool in that you also get to inject and kind of see.
So you can inject them with real product. And then you can pull their skin back and see where it went and how far. Wow.
So they typically put dye into like filler, for example, and
for this lab.
For these specific labs. And then you inject them.
Wow.
And then you're like, oh, moment of truth. Pull the layers of the skin back and you're like, oh.
Wow.
I'm either in the right plane or I'm in the wrong plane. And so you learn a lot just.
So then do you clean the filler out of there and do it again?
I didn't clean the filler out, but you can inject different layers or inject differently so that you can feel if you're in the right layer, what it feels like. I mean, obviously they're not alive, so it's a very different feeling.
I would never want to go to an injector that hasn't been to at least one cadaver lab.
Yeah, I think it's important. I think every injector should go to one because it's really cool and you learn a lot too.
I feel like going to the in-person trainings would be incredibly helpful and so necessary too. But you can't, I mean, even with an ultrasound, you can see.
Yes.
You can.
Yes.
Something about seeing it directly inside of the face, though, would be, you can't replicate that unless you're actually doing it. That's cool.
Yeah, and ultrasound's really important. I don't have ultrasound in my practice, but it's an important tool to have because as you're injecting, you can actually verify if you're in the correct plane, right? So,
wow. Thank you for sharing all that stuff. I've never asked anyone about that. Maybe I should keep going. Maybe we should do some series about the different layers of anatomy. But in all honesty, it just brings up so many other questions that I have. Just like everyone's face is so different. Yeah. And you have someone that could be 100 pounds, 200, 300 pounds. And the fat pads in the 300 pound compared to the 100 pound may be completely different, probably completely different. And you have to know how you would inject any type of person. Yeah,
and arteries and veins. I mean, we have textbook. This is how they supposed to run. Yeah. Maybe they run a couple millimeters to the right or more medial. But in the cadavers that we were assessing, we would peel things back and we're like, whoa,
it doesn't look like my book.
Way more medial than I thought the angular artery runs, or way more lateral. And so it's scary because we don't have x-ray vision. So we have to use what we know and just be as safe as you can possibly be. And knowing anatomy and knowing the variations and that no one person is the same is also important to know.
I like that it's scary to you.
Yeah.
Because that shows that you're cautious and you're aware, acutely aware of each one of your patients, and you pay attention. That's what you have to have.
Absolutely.
That's amazing. I want to talk about also, because you have a team. You have an esthetician. You have Carmen. What's your esthetician's name?
Stephanie.
So there's 3 of you, two people doing treatments. But when you started, it was just you.
I actually started with an employee.
You did?
And
you're smart.
1, I took a leap of faith. And 2, I started with an employee while I was still building a business from scratch. And so I was paying an employee.
Was Carmen the employee?
No, it was Stephanie, my esthetician.
It was Stephanie. So you said, let's do this. And she's like, I want to go work for someone else. I'm going to work for you. Mm-hmm. Did she have a book, a business?
No.
Yeah. And you had not done any aesthetics before because you're an injector. And so you really didn't have any. So can you share something that you did to get her book of business up and running? Like, what did you do? Did you immediately start doing paid ads? Was it organic? Did pop-ups? What did you do? Other things?
Honestly, we didn't start doing paid ads for about a year.
Yeah.
After opening the practice. And I will say it made all the difference. But with Stephanie, I was growing by word of mouth, which we found out really quickly that, of course, I had patients that I was already seeing.
So
and
you
then
could, yeah.
They would refer me, they would refer their friends and their family, but that's a really slow way to grow. And
it's a free way to grow.
It's a free way to
grow. It's freaking slow.
But it's very slow, especially because I had stepped away for a little bit.
Yeah.
And with Stephanie, we had to find something that we can do. So to try to grow her books, and obviously she had friends and family that she was treating, and she was growing too, referral wise, but we had to figure out something that we can do, and we ended up coming up with this really cool thing called follow-up facials, and we still kind of have them. And patients who came to get injectables, is kind of like a thank you. We gave them a little discount, and we gave them a facial at their 2-week follow-up. So I like to see my patients at 2 weeks. And then my husband,
was the facial complimentary?
It was 50% off.
Wow.
And that's how we started growing.
They're coming in anyway.
They're coming in anyway.
You want to get a 50% off facial? Did anyone say no?
Hardly anyone.
Hardly anyone would say no to
Hardly anyone. And so that's kind of how we started growing her
smart.
Client base. I know. My husband, I have to give him all the credit because he's the one that had this amazing idea. And so that's how she started growing, is just once you introduce someone to a service, and Stephanie's amazing. I was going to say,
it's an amazing idea. It's only going to work if she's amazing.
She is amazing. Yep. And she's also has really great retention, but I think it's because she's so great at what she does. And I knew that. So I'm like, we just need to give people the opportunity to see her. Yeah. And of course, just like ads, you've got to give somebody something to try it out. Right. Yeah. So, and it worked. And so she's kind of doing that. And we still do something similar, as a thank you to our patients who come see us. And, it's obviously not that heavily discounted, but,
don't need to do 50% off anymore.
Yes, but it was something that helped us grow her books too, and that was one of the hardest things.
Did you have a hard time converting people back into future facials if their first one was 50%? This is an objection I get a lot with my clients, is that I don't want to be a discount spa. Correct. I don't want to get a Groupon customer. I don't want to do this or that. But was it, and then my rebuttal is, people understand that you're getting them in at a discount to become a customer so that they can see why you're different. Is that your experience too, or did you have trouble?
I think that I don't think I've had trouble with retention on her end. Yeah. Because she's so great. And same thing with us, right? We run paid ads for talks, and they come in, but we let them know, you know, obviously you're a new patient, you're getting this new patient promotion, and this is our regular price. And once they've experienced just you and the results and just knowing that, and they like you, they're going to come back. And not all of them are, you know, you don't get all great people from ads. Not everyone's going to stay. And we know
even
that.
The word of mouth referrals are not all great people.
Correct. So, and we know that. So it's not something that we're like, oh my gosh, this person didn't return, but we know that a lot of those patients will. And sometimes once you build that trust, it's just so easy to convert them to other services because they trust you and they know that you're not going to recommend anything that is not going to be a benefit to them. So, because that's just not how I operate. It's not, I don't sit here and try to sell somebody anything. No. This is what's going to be a benefit to you.
Yeah. You told me what you want. Mm-hmm. This is how you get it.
Yeah.
Do you think your kids will listen to this?
My kids? Probably, but they might not know anything that I'm saying.
Mommy, what's a cadaver?
Yeah, my daughter.
Can I show you?
Yeah, no, my daughter knows what a cadaver is because she pays attention to everything.
I love that.
So she was like, what were you doing? Where were you? And then I told her I was taking a cadaver course, and she's like, well, what is that? So I had to show her.
You showed her pictures?
Very intrigued. Mm-hmm. I did. And my little one she loves gory. She's our crazy little one. And he's
boy.
Yeah, he's in trouble.
Ryan's just over there like, I don't know what's going on with these people.
And she asked me, she said, what was it? And I said, it was a dead head.
Oh, man.
And
my kid would be freaked out. That's not normal. It's not abnormal, I don't think, but like my kid would be freaked out by that.
Yeah, no, she was like, this is so cool. And I showed her like, these are what cadavers are. And this is how mommy learns. And
it's got to be because it's just so normal to you and you're normal about it. I wouldn't know how to have that conversation.
Yeah. Just like I went to go peel layers.
Yeah. This is what I did. Do you want to see it? Sure.
Yeah.
It's because I really feel like that's true. Mm-hmm. And that's amazing. So eventually they'll either listen to it now or they won't. But like, I want you to talk to them for a second. What's something that you want them to know that they can like do anything that they want to, or you're just proud of them? Like, just talk to them for a second. What's something you want them to know?
Of course. And I think that it's hard being a business owner and a mom.
Yeah, it is. We didn't even touch on that, but it's hard.
It's hard. And my husband picks up the slack a lot. So he sees the kids a lot of times more than I do. But I know that what I'm teaching them is that they can really just do anything they put their mind to.
Yeah.
And that there's no limit to what they can do. So if I could tell my kids something, it would be that.
Love that. They're watching.
Yeah, they are. And she's with me. She was with me today. Ella Langley. I mean, I'm like, there's Aria. She's totally with me today.
I love that. Thank you for being here.
Yeah, thank you so much. It was an honor and it was so much fun.
The honor is mine. How do people find you? luxlabaesthetics.com, LUXLAB aesthetics.com.
Yeah, luxlabaesthetics.com.
Yep. And your Instagram is?
At luxlabaesthetics.
Perfect.
Yeah.
Perfect. Thank you again for being here. Really appreciate the conversation. And thank you for listening and watching. Until next time, take care of yourselves, everybody.